can see us. Hi, guys. Alrighty. We are live with Dr. Jennifer Vines, and you are the Deputy
Health Officer for Multnomah County Health Department.
For Multnomah County. Okay, and we are talking about the measles.
Mm-hmm.
So, Dr. Vines, kind of tell us, first of all, we've been hearing, the word outbreak.
Mm-hmm.
It's partially the media's issue, but we want to let people know. Bottom line is, if you're vaccinated, if your kids have had your shots, we have nothing to worry about, right?
Right. So if you and your family are up to date on your measles vaccine, or if you're sure you've had the measles in the past, then you are considered immune for life, and you basically have nothing to worry about.
Okay. So when you hear all these exposure sites, especially like yesterday, we heard OMSI was one of the sites that a child with measles visited. What do you say to parents?
I completely understand parents' worry when they see those exposure sites listed. We do get the word out that around those exposure sites so that the healthcare providers in our community know that measles is here, because that's important information for them. In my career, so far, we have not seen cases linked to a public exposure, but there are no guarantees in an outbreak, and so we err on the side of informing the public and especially making sure our healthcare systems know that measles is a reality right now.
So every day when we hear these cases tick up, by one or two people, you said it's kind of rare to be infected at one of these exposure sites, which is great for the public. Who is getting sick? Is it most likely a family member of that person who's taking care of them at home or something?
So it has to do with the public health response. So when we find a case, we quickly figure out who are the people who've been around that sick person, and we really focus on those who don't have evidence of immunity, and we make sure that they know to stay home and stay away from other people for 3 weeks. When someone who is susceptible to measles and has that close a contact, we expect to see spread. It's a really contagious disease. So I have not been surprised to see the case count tick up slowly as public health identifies these additional cases. What I am watching for is, can we slow down on some of the public exposure notifications? And I think that'll be reassuring if or when that happens, that the outbreak is headed in the right direction.
Yeah. Okay, so a lot of people on social media have been asking me if they had measles back in the 50s or the 60s or whenever, even recently, can they get it again?
So if you're sure you've had measles in the past, then you have lifelong immunity. Measles was so common a couple generations ago that we say if you were born before 1957, you are considered immune because it was such a common disease of childhood. That said, for anybody who's worried, who wants to be sure, getting the MMR vaccine, the measles, mumps, rubella vaccine, just one dose would be an additional peace of mind.
Okay. What about if somebody had the vaccine, maybe they got it in the 60s, it's obviously probably changed since then. Do they need to get a booster? Do they need to change anything if they had it, several decades ago?
So what we would say is if you've had one documented measles vaccine, you should be immune. That said, we rely a lot on documentation, and so we're looking for the vaccine, the date it was given, and that's considered a really gold standard that you in fact got it. If you don't have that or you're just not sure, there's no harm in getting an additional measles, mumps, rubella vaccine if you want that peace of mind.
That's a great point. So if you can't, a lot of people can't remember. I don't have my paperwork. I'm sure I got it. I think I know I got it. But yeah, if you're not sure and there's no way to go back into those records, you can just get a new one. It doesn't hurt.
Correct. There's no harm to getting an additional measles, mumps, rubella vaccine.
Okay. And I don't know if you know this offhand. How much does it cost to get the shot?
I don't know that offhand, but we do have the Vaccine for Children's program, so that's funded federally, and that's to make sure that at least for anyone under 18, that children can get vaccines at their clinics regardless of ability to pay.
Okay. Let's see. Let's talk about somebody on Facebook also had a concern about they had a certain type of cancer, and they didn't specify if they had been vaccinated or not. But during this kind of heightened awareness time, if you do have kind of an immune system, illness or disorder that kind of makes you, more susceptible to get sick, should they be worried? What should they do?
So I will say right now there is no formal public health recommendation for people to avoid public settings. That said, for somebody who has specific health concerns, who may be more vulnerable or may have cancer or an immune system that doesn't work as well, that for sure is a question for their personal health care provider around what precautions to take, whether if they have had the vaccine, if they can still count on the immunity, and then what steps to take if they find out they are exposed to measles.
Okay. Let's see if we have any questions so far. I had measles in the 50s. Let's see. Okay, Donna had a question. She said, what if your child has only received one of the vaccinations? And like my daughter is 16 months old, so she's had her one shot. And I believe the immunity is 93%?
Mid-90s. We say 95%.
And then the second shot comes when they're like 4 to 6 years old, and that makes you what percentage immunity?
We get close to 99% of people. And so I'll say a couple of things about that. So the MMR vaccine is recommended at age 1 year. So usually children who are in childcare or preschool are considered up to date and protected if they've had that first dose. Again, 95% of them will have lifelong immunity. By kindergarten, that requirement goes to 2 MMRs, and it's not a booster. It's to capture those extra few people who maybe didn't respond to the first one. So again, we're looking at a definition of fully protected once you're kindergarten and up as having had 2 doses of MMR.
Okay. So I'm trying to get the questions back again. Okay, so let's talk about school kids or school-age kids, because we're coming up on Exclusion Day. Tell people what Exclusion Day is.
So Exclusion Day is it's vaccine policy at work. So that is the deadline when parents have to have their kids either with evidence of the required vaccines for school, or they have to have their paperwork in order if they're going to claim what's called an exemption, which means in rare cases that for medical reasons their child can't get a certain vaccine, or that they've done the education and prefer to delay or decline vaccination. And that's commonly called a non-medical exemption, or some people refer to it as a personal belief exemption.
So kids can still go to school unvaccinated after Exclusion Day. They just have to sign a piece of paper saying that.
Yeah, so parents have to do some education. They have to get counseling around vaccines, because in general vaccines are safe, effective, and they're really good at protecting kids from serious diseases and protecting the entire community. But parents do have the option in Oregon to decline or delay those vaccines and still send their child to school. The caveat is that when we get a case of measles, for example, or we have an outbreak of disease, those records are important, because those children actually can be excluded from school. In the case of measles, for 3 weeks while they go on symptom watch, they are actually not allowed to be in school.
So that's where the Exclusion Day wording comes from. It's
Yes.
not that you can't go to school from that point on. It's if there is an illness.
It's actually, so we use exclusion in a couple ways. School exclusion means that's the deadline, which means if you don't have your child's paperwork in order on that day, again, there have to be rules. So if you are not in compliance on that day, your child cannot attend school until you get your paperwork and vaccine records in order. We talk about excluding children from school in an outbreak when we know that they are not fully vaccinated, and we can keep them home for 21 days. I'm sorry, we can keep them out of school for 21 days.
Okay. Are we in that period now for any districts in Oregon? If there is one case of measles in Oregon?
I can only speak for Multnomah County. We are not pursuing any kind of school exclusions around measles in Multnomah County.
Currently, okay. It would have to be a child in the school district that would have to come down with measles to trigger that?
Yeah, and measles is so contagious that even one case in a school actually triggers that kind of response of figuring out who is potentially vulnerable to the disease and keeping them out of school for those 3 weeks on a symptom watch.
You were saying, so they have to sign the paper and they have to do some education. What does that mean? I mean, is there like a video they have to watch or paperwork they have to read and sign? How does that work?
Yeah, so typically, they can get counseling from a healthcare provider. There are also some modules online with just some educational videos that parents watch and then sign saying that they've watched.
Okay, and that's it. And then you file the paperwork and say, this is my personal reason for not getting vaccinated.
Correct. I don't know that parents have to give a reason, only just distinguishing between a medical reason why your child can't be vaccinated versus a non-medical reason or personal belief.
Okay. And then you have those kids by name on file of who is vaccinated and who is not vaccinated in the school. So if someone gets sick, you know exactly who needs to stay home.
Right. We would work very closely and very quickly with the school to figure out who is vulnerable to this disease and who do we need to keep out of school for 3 weeks.
Okay. How do you, as a doctor, how do you kind of feel about this growing wave of anti-vaxxers, that, I mean, there's some pretty harsh backlash, against those personal beliefs online. A lot of people have no sympathy if this is spreading. What's kind of your view as a doctor? How do you kind of see this playing out right now?
So I am by training, I'm a family doctor, I'm a public health doctor, but I'm also a parent, and I truly believe that parents try to make the best choices they can for their children. So I come from that angle, and my heart goes out to these families whose children are sick, because measles is a bad disease. I think when I think about sort of the vaccine issue in Oregon and Washington, that's no secret, what I would point out to most people is that a lot of parents, the vast majority of parents vaccinate, and they vaccinate on schedule, the gold standard for, getting the best protection for your children at the right time. The majority of parents do that, and they, they get that it's the right thing to protect their children and to protect the community. In the minority who don't vaccinate or who delay vaccination, there's a very tiny minority within that group that is probably not going to listen to me, and those are the people who have really deep beliefs around conspiracies or really will not be swayed that vaccines are safe. I am most interested in reaching kind of this middle group, which we call vaccine hesitant parents. And again, those are parents who they've heard a lot of information. Maybe they've read online, some rumors about vaccine safety, and they're just not sure. And they maybe opt for a delayed schedule, or they put off making the decision around vaccines. It's those parents that I would like to reach with the message that vaccines are safe, they're effective, and they're one of the best ways to protect your children from some really awful diseases.
It's just there's so much online to read. You hear, you see a celebrity, maybe I remember Jenny something, and she, was perpetuating the rumor that these shots cause autism, which is what? Not true. Not true.
That question has been looked at. The original quote-unquote science has been completely debunked and retracted. A lot of research and thought has gone into looking at that question, and there is no evidence that the measles vaccine causes autism.
Okay. So we're trying to reach the middle ground of people who are kind of hesitant. What's their, you said that they just kind of read something, or they remember somebody saying something, and that, it can have, bad effects.
It can, with that kind of. It can have bad effects, and again, I think parents are doing the best they can with a lot of information that maybe for new parents is just overwhelming. It's been a while since I've counseled parents directly on this topic, so I can't speak to exactly what parents' concerns and fears are, but I do know that I think one approach is sort of to hedge and to delay the schedule, or to sort of pick and choose. And I think until these diseases become real, that's okay. But now we have measles in our area, so now it's quite real. And so I'm hoping, for better or worse, to see some additional uptake of the measles vaccine.
Okay. If you guys are just joining us on Facebook, we're talking with Dr. Jennifer Vines with the Multnomah County Health Department about all the measles questions that you guys have. And I think it's really important to kind of put measles in perspective. It's such a scary word. It sounds like a scary virus, which it is. But really, when you put it in perspective with the flu, I was looking at some numbers this morning from the CDC that said last year, in 2017 alone, 80,000 Americans died from the flu. And for measles, 11 people have died in the past 18 years. Is that kind of an important distinction you want people to know? Like, the flu is way more common, and we should be, way more vigilant about washing our hands and getting a flu shot and stuff than freaking out about the measles, basically.
No question that influenza can be a serious disease, and we are in the middle of flu season. I think the numbers that you're pointing out really emphasize the fact that measles was considered essentially eliminated in this country thanks to a really good vaccine. It was a common, miserable disease of childhood with complications. So, healthy children getting hospitalized with bad ear infections, pneumonia, a complication called encephalitis, which is when the measles virus causes inflammation around the brain. And we quote, 1 to 2 per 1,000 who get measles will die from it. The fact that we can prevent all of that with a really good vaccine that is safe and effective was a public health win. And so I think the reason we get on top of measles is that it is so contagious. We have really good tools in our toolkit as far as the public health response and an effective vaccine. So we put our effort there. Influenza is kind of a separate conversation. It tends to affect elderly people. We see, unfortunately, people dying of flu who are either elderly or have underlying medical conditions. The flu vaccine is not perfect. It's a good tool, but it's also can be difficult to match that vaccine year to year with the virus and get people to get in and get their vaccine every year. Measles, one vaccine, 95% of people have lifelong immunity. So I think that's the real difference that I would emphasize.
Yeah, do it once and you're done. But the flu, you got to remember to do it every year.
Right.
Okay. Okay, so Kayla Thompson just asked us a question on Facebook. She says, what about people with children under 1 who can't get the vaccine yet? Great question. If you're taking your baby out and about, you got to do errands. Should they be worried?
So babies can get the measles vaccine safely as young as 6 months. If you look online, there is a recommendation that for parents who are going to take their children to travel, say to countries where measles is known to be in circulation, that you can actually get an early measles vaccine for your infant between the age of 6 and 12 months. It won't count towards your school requirements, but it can offer some protection. So there is no formal public health recommendation for early vaccination of infants at this point because of this outbreak, but that is something that individual parents could talk to their individual healthcare providers about. And again, there's no formal recommendation to be avoiding public spaces. We are hoping to use all the tools in our toolkit to get a handle on this outbreak, but I can't predict.
If you're really worried about it, or you're going to be traveling, you can get the measles shot at 6 months. But then I think you still need that 12-month the other first shot, right?
Correct. For your school requirements and to be really sure on your lifelong protection, you would need it again at 12 months, and then at least a month later for dose number 2. So those infants potentially would need 3 total vaccines to be considered up to date.
Gotcha. Cool. Let's see what else we can ask. What about these exposure sites? We've been listing all these addresses, the dates. We've got Walmart and Trader Joe's and OMSI and all kinds of, medical clinics. And it was it's usually a specific time period that's a couple hours. Should people avoid going to those places? Should we not go to OMSI? What do you kind of say to that?
Yeah, so again, I don't have a formal recommendation that people avoid any particular place or avoid leaving their house. I think each family, each individual has to live with the level of risk or decide what level of risk they can live with. And as someone who works in public health, I think we're social creatures. I think anytime people mix, there is some risk of disease transmission, whether it's the flu, whether it's measles. So people have to decide that for themselves. I will point out that we list the public exposures as we feel like it's our duty to inform the community when there's a potential exposure, because measles is transmitted through the airborne route, which means someone can cough it into the air. It can linger. We can't always, we talk really carefully with the people who are confirmed to have measles to try to figure out where they were to really kind of pinpoint who may be at risk. And we can't always account for their every movement. So we err on the side of caution in informing the public. We're watching closely to see if we get cases linked to those public exposures. In my career, again, measles is rare, but in my career, I have not personally seen a case linked to a public exposure.
Plus, I mean, if OMSI, it was January 19th from 2:30 to 7 p.m., now that was almost 2 weeks ago, it's totally safe to go there, right? I mean, it was only in that window of time.
Right, so that potential exposure has come and gone.
It's safe.
Right, and there's no special sanitizing. Again, measles will, as air flows through and as the virus, dissipates, there's no ongoing risk.
Okay. very important to point out. So you can go to all these exposure sites now. It was only at that specific time on that specific date, and we have all that stuff on kgw.com. But yes, they're all safe to go to now.
Right.
And it's not like, what's kind of frustrating is like hand sanitizer does nothing for this. It's airborne.
Right.
Okay. What about, let's see if anybody is asking us questions.
I have one.
Go ahead, photographer Ken.
Yeah, so the question is, and maybe you've already responded to this, but if a third grader hasn't been immunized, how long after he gets that first shot until he's okay?
Thank you. Yeah, so the question is, how long after that first shot is somebody protected? And we say about 2 weeks. So within 2 weeks, 95% of people will have lifelong immunity to measles after that first shot.
Great. So and it's never too late to get a shot. If you've been on the fence and this is scaring you enough now, and you go in today and get your shot, you'll be immune 2 weeks from now.
Correct. It is never too late to get the measles vaccine.
Okay. Great question. Let's see. Somebody else had something. Oh, Sarah Vincent. Hi, Sarah. Thanks for watching. She says, does the vaccine cause thousands of injuries annually? That seems to be another myth. I'm not sure quite what injuries means, but what happens to you? Because we see the pictures of the red rash, but that actually, doesn't kick in till like the third or fourth day. So initially you may think that you feel cruddy, you have a cold or something at first.
Well, yeah, right. So most of the side effects of the vaccine that are known and listed, the most common ones are things like pain and swelling at the site of the injection.
You said the cause of the vaccine, but you mean the virus.
I'm sorry, I understood. I'm sorry, could you repeat that question? I'm not sure I understood.
Oh, no, yeah, she does. Oh, she did say the vaccine, yeah. She says, does the vaccine cause thousands of injuries annually?
So the most common side effects from the vaccine are things like pain and swelling at the site. Those are by far the most common. She may be referring to national numbers, and there is a vaccine adverse event reporting database. So I would have to do more research to know exactly what gets reported in that database, and then people sift through those reports to see what can be attributed to the vaccine. So I know that happens, and again, this is a vaccine that's been around for a long time. It is widely considered safe and effective.
Okay, gotcha. Let's see. Sarah also asked, can you explain how a live vaccine works?
So she's absolutely right that the measles, mumps, rubella vaccine is called a live virus vaccine. That means it's made from a virus that's been weakened enough to not cause disease, but still looks like the virus, and so your body learns to recognize the virus and mounts an immune response that then protects you for the rest of your life when you actually encounter the real strong virus. So that's part of what makes it such an excellent vaccine.
Okay. Maybe you know what this question is. Heather Fields, thanks for watching, Heather. She is asking, what about shedding? People keep asking, can it shed? Do you know what that means? I don't know what that means.
Shedding, she might be wondering about shedding after vaccination with a live virus vaccine.
I don't know.
Or shedding virus. If she's wondering about how long people with measles are contagious and shedding virus, we usually say they're contagious from 4 days before they get the classic rash until 4 days after the rash. And so often by the time they get seen by a healthcare provider and tested for measles, it's typically the rash that brings them in, which is why we end up with these exposure sites from the days sort of leading up to illness, is that we do that math. And then part of our public health response is making sure they stay home until 4 days after the rash.
Okay. Good question. I'm still fielding. Okay, Amanda Nelson, thanks for watching. She wants you to talk about herd immunity and kind of what that is. Hold on, if I can kind of scroll. What about herd immunity? How does that work in areas where many don't immunize their children, like Clark County, who has a 23% rate of unvaccinated, whether it's religious or personal reasons, of people. So what is herd immunity and kind of how does it work to keep everyone safe?
Thank you. That is a great question. So herd immunity is when you have levels of protection in a group of people. So for me, that's, I think, in terms of the county. So when you have enough protection in the county from people being vaccinated, then if the virus gets introduced, it doesn't have anywhere to go. So chances are it's going to maybe find someone who is susceptible, but then from there it's only going to bump into people who are fully immune and don't get sick and then can't spread it. because measles is so contagious, we actually need a really high level of herd immunity in order to contain it. So most public health experts would say, around 95% of people have to be protected to keep it from spreading. When I look at my county and I see, and I look at the levels of vaccinations, we are below that. And then not only are we below that, but a lot of those kids who are vulnerable to this infection, they tend to go to the same schools, or they tend to kind of be around each other in certain communities. And so that's where we've prepared for an outbreak like this, because we know that it's a really contagious virus. If it gets introduced into that kind of community, then you can see a lot of spread. And we need to mount a public health response as we have.
Is it kind of a cultural thing sometimes? Like you were just kind of saying, a doctor I spoke with yesterday who's an infectious disease specialist said that he's seen a lot of cases, in the Philippines and the Ukraine and some places, that are third world countries that maybe, don't have access to the vaccine or it's too expensive, but some places just have, some cultures or countries just have that philosophical belief that, or they've had bad reactions to it, I think, in their country or something, that it scared them and they don't want it. Is that kind of what you?
I'm not sure I could generalize on this. I think there are groups with different beliefs and different attitudes around vaccines. I think we in public health need to understand the nuances of those beliefs. But I don't think I have a clean answer. I don't think I can sort of make a general answer to that question.
Okay, let's see. Scrolling through all your guys' questions. We talked about herd immunity. Everything I do is more risk of catching measles. I thought shedding was someone who gets the vaccine. This person says, I thought shedding was someone who gets the vaccine and gives the measles to someone else.
I think in general, getting a live virus vaccine does not put others at risk, but I would have to double check, and I would urge anyone with that question to double check with their healthcare provider if they're seeing someone who has a very, very weakened immune system.
Okay. And if you guys are just tuning in, we're talking to Dr. Jennifer Vines with the Multnomah County Health Department. You've been excellent at answering all of these questions. I think it's really important to reiterate again, if people weren't watching this, because this was our first question whenever we started around 11 o'clock. When parents or people in general hear this, my mom came over today and was like, have you been hearing about the measles? And I said, Mom, I'm in the news. Yes, I have heard about the measles. And I said, she hadn't heard the part where it's okay. If you have the shot, you're fine. I mean, please reiterate that to people. This is not something to panic about at all if you have your shots.
Right. So if you are worried about the measles, the first thing to do is to make sure you're up to date. For adults, for just any generally healthy adult, that's typically one MMR vaccine documented. For school kids and for healthcare workers, we have a higher bar of 2 MMR vaccines. But again, with just the first one, within 2 weeks, 95% of people have lifelong immunity. It's that second one that gets us close to 100% and keeps individuals and our community safe from this disease.
So if you have your shots, don't be worried about these exposure sites. Go wherever you want. It's okay.
Exactly.
Okay. I was going to also ask about something else. Sorry. People keep kind of writing in, so it goes back down. And also, to reiterate it again, if you've had it before, can't get it again.
Right. If you're sure you had measles as a child, and in general we think of anybody born before 1957 as almost certainly having had measles because it was so common. Again, if you've had the disease, you also have lifelong immunity.
Okay. What if you're not sure if you're vaccinated? What if you can't find your records, your parents, aren't around to ask? What do you do?
Right. So if it was a long time ago, you're not sure, you want peace of mind, you can get a measles, mumps, rubella, MMR vaccine, and get that peace of mind. There's no harm in getting an additional vaccine later in life to get that extra insurance.
Okay. What do they do? Just call their doctor? Does anywhere give them out?
Yeah, most healthcare provider offices can direct you. Pharmacies, So it's a vaccine that's generally readily available.
Have you guys been getting extra calls of people wanting to get the shot, do you think?
I'm hearing more and more questions about vaccination, and again, right now there's no special public health recommendation about like changing the normal vaccine schedule or additional precautions. I think we'll be watching this outbreak closely with all of our other public health partners, and if that changes, we'll certainly let the public know. But at this point, we are on a routine vaccination schedule.
A lot of folks watching us, from Clark County. I know you're a Multnomah County health director or deputy officer, but should parents of kids in Clark County do anything different if they're going to school? If they have, should they pull their kids out if their kids aren't vaccinated? Should they not be going to school now if it's one of those exposure sites? Evergreen High School was one of those. Off the top of my head, I can remember there was many other, primary schools that were involved. What do you kind of recommend, do you think?
Yeah, so I can't speak for Clark County, and I don't know the details of every message that they have put out. So I would urge parents to be checking Clark County's website. If a school sends home a letter or a notification with instructions, by all means, pay attention to that. And then the best thing to do if you're a parent living in Clark County who's worried is just make sure you and your household are up to date on your measles vaccine.
Go get one. Yeah, it's easy. Okay. How are we doing? Do you guys have any more questions that I'm not seeing? Let me see. Scrolling through. What are the risks for pregnant women? Whitney Webb wants to know. I think she means for the measles in general, not the shot.
Measles in general, not the shot. Okay.
If you're pregnant.
So measles can cause serious complications if a woman is infected in pregnancy. So part of the public health response is we look at the people who are around someone who is confirmed to have measles. We focus in quickly on pregnant women who are susceptible. So these are pregnant women with no prior vaccination, no prior disease. And we can actually get them a just-in-time treatment to lower their chances of getting the measles infection in pregnancy. But it can cause complications during pregnancy, which is part of the reason why pregnant women cannot get the MMR vaccine, because it is a live virus vaccine.
That was my next question. Can you get the shot while you're pregnant?
Right.
The answer is no.
Right, and that is a precaution. So again, pregnant women who are exposed are our number one priority. Anybody thinking about pregnancy but not pregnant yet would want to talk to their healthcare provider to make sure they're immune to measles.
Okay, good question. Let's see. So Tracy wants to know, thanks for watching, Tracy. If you're immune but you're exposed to the measles, can you be a carrier to spread it? The answer is no, right?
The answer is no. It stops with you if you are immune. You cannot get it and you cannot spread it. So there is no, I think what questions are getting at is if there's like a carrier state for measles where you can like potentially spread it but not be sick. The answer to that is no. If you're immune, you can't get it, you can't spread it.
Okay.
And if you have it, you know it. And again, if public health finds out, then we are making sure that you're staying away from others.
Okay. That was Rebecca Kaihani's question. I see you, Rebecca. She asked kind of the same thing. If you are vaccinated but come in contact with the virus, can you spread it to a baby? No.
The answer is no.
Yeah, if you're vaccinated, you're all good. Let's see. A lot of people asking about pregnant women. We just asked her that question. What about, here's a question for you. Some people are bringing up chickenpox. Do people get the chickenpox anymore?
People get chickenpox. There's a vaccine.
But it used to be like, when I was a kid, everyone got it. It was just normal. Once you had it, you were done, kind of like the measles.
Yeah, another common childhood illness that involves a fever and a rash, and now there is a vaccine for it. So yes, chickenpox is still out there, but there is a vaccine.
Okay, so it's like not as common nearly at all as it was.
It's much less common now than it was.
Okay, gotcha. If you had measles previously but not had an immunization, can you get it again? No. No, you can't get it again.
Correct.
Once you've had the measles once.
Right. If you are sure you've had the measles, then you are considered immune.
Okay. If you had the vaccine, received a titer, I think that's a misspelling.
Okay.
I don't know. That showed you were not immune and received another vaccine but never checked your immunity, is it possible that it didn't work?
Okay, so
That's from Trish. Thanks for your question,
yeah,
Trish.
that's a very nuanced question. I'm getting this question a lot. So so the word titer refers to a blood test that you can get to test your antibody response to measles.
Okay.
Some people talk about it as a way of proving immunity if you think you had the disease in the past or you're vaccinated. Some people go that route. The problem with the titers is that they don't always tell us if you're immune. So they don't always react in the way that we want them to in terms of the lab result to tell us that you're immune. So even for healthcare workers, which is the highest standard of measles prevention, if you have had 2 documented measles vaccines, you are considered protected, even if your titer is negative. So even if we can't find the antibodies, we are so confident in the vaccine that healthcare workers and anybody else for that matter who has had vaccine, it's that documented vaccine that actually overrules the negative blood test.
Okay. Here's an interesting question from Mike here on Facebook. He says, when he was little, he caused an outbreak of measles in his school. How does it start in the first place? That's a great question.
So
do you pick it up on a surface somewhere? I mean, how does it kind of start?
So measles is airborne, which means somebody who is sick with measles coughs or sneezes it into the air, and it hangs out. It can hang out in these very fine droplets. If you think of like almost an aerosol mist in the air.
But how did our patient 0 get it?
So that's a question for Clark County for this outbreak. Okay. What I can say is, in general, so on a normal day, we don't have measles in the Portland metro or Vancouver metro areas. Typically what happens is somebody travels outside of the state, picks up the virus, comes back and gets sick, and that's how we see spread, or that's how we identify a case and work to stop spread. So you have to, again, in normal circumstances, you would have to travel outside of our local area to be exposed to measles.
I see. Okay. And that's why we're seeing, I think today there was a case in Hawaii. Bend now in Central Oregon has a case. Let's see. Oh boy. Okay, here's another. So Jennifer Calderia. Hi, Jennifer. Okay, here's her question. Can people with primary immunodeficiency who have had the vaccine but are immunocompromised, like kids with cerebral palsy, can they get the virus, even though they're vaccinated but compromised?
That is such a technical question. I would have to refer that person to their individual healthcare provider. I don't think I can answer that question with the level of confidence that question deserves.
Okay. Tara Barrel says, how long after you come in contact with someone would you get sick?
Mm-hmm. So it's typically between 5 and 7 days after exposure that people get sick. It can be anywhere. It can be as far out as 3 weeks, which is why I mentioned before kids are put on symptom watch for 3 weeks if they're exposed and not immune. But typically about a week or 2, so between 1 and 2 weeks after the exposure is when we in public health are paying probably closest attention to the people we think are likely to come down with the disease.
Okay, so let's go through the symptoms at first. Like the first day, what do you feel like when you have it?
So it's typically, so think virus. So think about what a bad flu might feel like. And so measles is a virus, so it's similar. So it's kind of feeling all over bad. So muscle aches, feeling tired, fever, and the fever is significant, like 102, 103. And then we talk about the 3 C's of measles, and this is more for healthcare providers, but it's cough, conjunctivitis, which is inflammation of the eyes, and coryza, which is a medical term for just a really, really stuffy nose. And then usually as the fever peaks, that's when people get a rash. And the classic measles rash, it's a fine red rash that starts around the hairline, usually on the face or neck, and then spreads down the body.
And everyone gets that rash? Mostly.
No, I can't say every single person, because there's always sort of a spectrum in how people actually show symptoms of measles, but that is the classic measles disease. And so for someone who is non-immune, that's the kind of disease healthcare providers would expect to see. Okay. And I will say people are miserable. So some people mistake it when I say, cough and congestion. They say, well, that sounds like a cold. No, these people are sick. And when we've seen cases in Oregon, about 1 in 3 has to be hospitalized just because they are so sick and so miserable. They usually need the level of kind of support that a hospital environment can offer.
Do they have to be like totally quarantined in the hospital?
They go into isolation. Yeah, they go into what we call negative airflow, where the air flows the air is pushing into the room, so that every time the door opens, the air is contained inside the room as opposed to blowing out.
Huh, okay. And if they're not hospitalized, they're at home, someone's got to help take care of them.
Mm-hmm.
They better have their shots, but probably not, right? If
Right.
it's a family that has well, maybe if it's a medical, reason.
Right. So we focus a lot on households who have, when we get a case, it's the household that's by far at highest risk just from their exposure. So we focus really quickly on household to figure out who's immune, who's not immune, who can we get a just-in-time treatment to, and then who do we put on symptom watch.
Gotcha. Okay. Let's see. I thought I saw one good question. Natasha Knuckles is watching. And we have gone over this question, but just for everyone who else is tuning in now, what do you recommend for parents of kids age 1 who have had their first shot? I'm worried to take my daughter out in public.
Okay.
Give her some peace of mind.
So for a 1-year-old who's gotten their first routine childhood measles vaccine, again, 95% of them will be protected for life.
So she's just fine, 95, and there's only a 5% chance that she could get it somewhere.
So that child would be considered up to date and protected. There is no public health recommendation to accelerate number 2 or to move up the age for number 2. That said, number 2 can be given anytime as long as it's been at least a month since the first vaccine. So, but again, no public health recommendation for that accelerated schedule. That child would be considered protected. If a parent really has to have additional peace of mind, they could approach their healthcare provider about measles number 2 1 month after measles number 1.
Okay, so Natasha, you're all good. Take your daughter wherever you want. She's had her first shot. She is safe. Get her second shot when she's, 4 to 6 years old or something like that. Okay. Okay, what else should I ask? So the flu is way more prevalent and worse and deadlier than the measles because it's just out there more because we basically eradicated the measles. Right?
So measles and flu, so similar. So viral illnesses, both can be serious. Both have a vaccine. But for someone like me, it's apples and oranges. Influenza affects, mostly elderly people. So unfortunately, the people who die of influenza are older. They typically have underlying medical conditions. The vaccine is far from perfect, and you have to get it every year. And some years it's a good match, and some not. But again, it's our best tool. Measles, on the other hand, was considered essentially eliminated from our country thanks to a really good vaccine. Unfortunately, we see when measles does happen, we see what Clark County is telling us, which is we see it affecting young children. Unfortunately, with a serious viral disease which can have serious complications. So for me, they're different in that way. Measles has been a public health victory, and we're working again to keep our community levels of vaccine high and to mount a public health response to this outbreak that hopefully contains this disease.
Okay, Heather asks a good question. Do you think this is a new strain of the measles?
Nothing to suggest a new strain of the measles, and I'm not aware of any information to suggest that this would be different or require any kind of unusual response other than what we usually recommend, which is be up to date on your vaccines and public health finding those susceptible people at risk and making sure they stay away.
All of the people, or at least 90-some% of the people who have the measles right now in this outbreak have been unvaccinated.
Right. So
nobody who has had their shots has gotten sick. So that's really important to point out. Sarah says, my daughter had her first MMR shot, but she didn't get the second. She's 9 years old now. I scheduled the second for this week. Good for you, Sarah. How worried should she be? So again, 95% of kids like this young girl would be immune with the first one. The second one is to get us to 100%. So good job. I would be reassured. There are no guarantees, but I would be inclined to reassure you. Okay, so Sarah, you're all good. But good on you for scheduling that second shot. Okay, I think we've asked some great questions. You've been wonderful.
Thank you.
Answering all these. And I mean, just again, kind of anecdotally, seeing this kind of happen, how does it kind of make you feel? I mean, is this just another public education opportunity, I guess, to, revisit the importance of vaccination?
I think, again, I'm sorry for the families who are suffering with this disease right now. I said it before, I'll say it again. I think parents just want the best for their children. So I think about the families involved. I also think, despite our best efforts, we have seen people either declining or delaying vaccines in both Oregon and Washington. So the team that I work with in public health has prepared for outbreaks. We've responded to measles before. So I am confident in our ability to respond to this outbreak, but I can't make any predictions on how this may go. So again, disappointed but not surprised, and confident in our tools to respond, with the caveat that I can't predict how long or how far this is going to go.
I thought it was really interesting. The doctor I spoke with yesterday said, and you talked about it a little bit too, because we virtually eradicated measles with the vaccine, most doctors have never seen a case of it, with their own eyes.
That is true.
So sometimes if they're seeing a patient in those 1 to 3 days before the obvious rash comes, it may get missed, right?
It can. I will say I have a lot of confidence in our local healthcare providers. I personally have put out a lot of guidance for our healthcare providers, just collecting what we know about measles and sort of some helpful advice, I think, for healthcare providers. And I am regularly impressed with healthcare providers' ability to really get down to whether somebody's at risk, really look at the symptoms, call public health if they need to, and respond to this, and really serve as our eyes and ears in this outbreak.
One more question. Katie Sackett. Hi, Katie. Thanks for watching. I see your question. And you did address this before, but just so now that she's watching. What are your thoughts on people who had the vaccine when they were a kid, and then later in life they did the titer and they have no immunity? Should they just go and get a new shot?
Yeah, so the quick answer to that is that documented vaccine is considered better evidence of immunity than a blood test looking for antibodies that can be unreliable.
Okay, so she had the shot, she should be good. Don't put all your faith in that immunity test. Right.
So the serology, or people call it titers, or the immunity test, those are imperfect. What we do consider really good evidence of immunity is a documented vaccine. Again, two documented measles vaccine is kind of the highest bar. That's for healthcare workers, for example, and for young kids. But for just a regular healthy adult, even one MMR documented, you'd be considered up to date and protected.
And if she's super worried about it, she can just go get another shot.
Right. You're right. For peace of mind, you could go get the second, and then really put your mind at ease.
Okay. Cool. All right. Thanks, you guys. Katie says thank you for answering her question. So great questions from everybody. Thank you so much. Stephanie says, and I think I know I'm getting to be an expert now on this. Should I be worried about my vaccinated child being around unvaccinated children?
No. So if your child is up to date and protected against measles, again, they can't carry it. They can't unknowingly transmit the virus. And if as long as they have responded to their vaccine, which 95% of kids will have responded and be protected, they will not get sick.
Okay, here's another. What about my infant? If you have a baby younger than 6 months, they are not vaccinated, being around her unvaccinated stepbrothers and sisters.
So again, this is what parents have to decide for themselves as far as what level of risk they're comfortable with their children. So first measles vaccine is not recommended until age 1. Kids can get it as young as 6 months. There is actually a travel recommendation that if you're going to travel with your child to a place where measles is known to be spreading, that you get them vaccinated early. So a mom or caregiver who's really worried could talk to their pediatrician about early vaccination, but there is no formal public health recommendation to vaccinate infants early.
And
so
if those stepbrothers and stepsisters, like she was saying, are unvaccinated, if they don't have any signs or symptoms, it's probably fine, right?
Well, that can be hard for me to reassure, because again, as we get cases and you see again our public exposures, kids are out and about doing things in the days that they're just starting to feel unwell before they get the rash and before we figure out that it's measles. So I don't want to over reassure on this, but that is how we end up with the list of public exposures, is that these kids, they are all kids getting diagnosed later and then figuring out that they were probably around other people during their infectious period.
Okay. Cool. All right, you guys. I think we can stop down on Facebook Live. Thank you so much, everyone, for watching. And there's tons of questions. I think we re-asked everything like 4 times. So if you do have a question, just re-watch this video. Dr. Vines most likely answered it. So thank you guys so much for watching. Great job.
Thank you.
Thank you.
Okay,